Congressman Rose, I've been following all of your updates on Twitter. I know you're very concerned. I know you both are about first responders. Tell me what's being done and what more needs to be done.
Absolutely. So let's group for a moment first responders as well as our nurses and our doctors. These are the frontline soldiers. The frontline soldiers in this new war that we're fighting. It's not a war against an army. It is a war against a virus. And we need, just as we saw in World War II, we need an all-hands-on-deck approach, a mobilization that includes all segments of society, and we have got to do it today. We have people dying each and every day in our communities in New York City, and we cannot allow for a slow evolution. We can't allow for the federal government to slowly wake up to this crisis. This involves the state, the city, as well as the president. What we see Governor Cuomo doing each and every day, we need that type of plan nationwide, because this crisis will move on from New York City, and it will move on somewhere else. And when that does happen, we can shift those resources there. But right now, we need the eyes of the nation and the resources of the nation on New York City.
Congressman Meeks, your thoughts? I mean, New York has been through so much. We've been through the 9/11 attacks. Our hospital workers don't scare easily. Our first responders don't scare. But this is a virus taking a toll on our police department, our fire department, and now, based on these two new reports, our frontline healthcare workers.
Yeah, this is absolutely something completely different. I was here during 9/11, and that was another catastrophic event, but it was an event where we urged people to get back on the streets so that we can continue our way of life. Here is just as different, and this is a long-term fight, the long-term war against this virus, as Max Rose just indicated. And what we've got to make sure, what our governor is trying to do, what our mayor is trying to do, is not only look at where we are right now, but look at where we will be in a week or in 2 weeks. And that's why we need every resource to come into the city, into the state right now. And we need the president to step up. We need to make sure that he's calling, if he can get additional people to manufacture more of the PPEs that is necessary. We need to do it because the lives are at the line. And when you look at those who are in the front, those doctors, those nurses, those individuals who are the EMS workers, they are all in jeopardy, and there's no way. They're heroes. They're putting their lives on the line, and we are the richest country in the world. We should make sure they have every piece of equipment that they need, and we need to get it now. And we need to make sure it's in abundance so that we'll be ready not only right now, but a week from now, 2 weeks from now, because that's when we believe the peak will happen here in the city of New York.
Congressman Rose, this was written about you in Politico this week. Representative Max Rose has turned his home in New York City into a one-man war room amid the epicenter of the national outbreak. Over the past week, the freshman Democrat helped secure New York City's first testing site in his district and pushed the White House and state officials to speed up procedural steps, such as approval from the Food and Drug Administration. We are building the plane as we fly it, Rose said. Why are we doing all this mid-pandemic? Why wasn't more of this done ahead of time?
Well, there certainly were preparations that could have been taken. But with that being said, we don't have the luxury right now to look in our rearview mirror. Not when we have people dying every single day, not when we have nurses and doctors on the front lines. So what needs to happen going forward? What needs to happen is we got to get that Naval Hospital into New York Harbor, 1,000 beds. We got to open up the VA to non-veteran patients. And we have to assert all of the president's power over the production of ventilators and PPE, because right now there's a global war going on for these supplies. And these private manufacturers aren't thinking about the cities that need it most, the states that need it most. They're just thinking about who can pay the most. It's only the president that can step in, use public funds to build new factories, use his authority to mandate what these private manufacturers do. I am heartened to hear that he is now deciding to do it. But we have got to move quickly, because in New York City, there's a fierce sense of urgency. Everything has to be done. We cannot express that enough. It's easy to stand up here and say this. What's hard is what our nurses and our doctors and our first responders are going through right now. They are waging war. They're soldiers, and we have got to be there for them, just like we're there for soldiers deployed overseas.
Congressman Meeks, I know you, both of you went to New York, I believe, to vote on the Relief Act, the bill that the president is signing today. We'll have that footage in a couple minutes for our viewers. Did it do enough for New York? I know the governor doesn't think so.
Well, we need to do more, but we did do, our jobs. We've got about, I think, over $50 billion into the state, putting the money into the hands of the average worker, trying to make sure that more money in unemployment, more money for hospitals, more money for PPEs. But I understand the governor's problem is that we need even more, because when you look at the money that should be going to the state so that they can make sure that they close their budget, because they are spending so much more money in this emergency, that they need more than the $5 billion that they got out of it. And the city got $1.2 billion. So we need more money. There need to be more resources, because if you look at the proportion of what's taking place right now here in New York City is where we are the epic center of this war. And so we need all of the resources to go to New York at this point. So we need more money, and we will need more. I think there's going to be a fourth bill that comes through, and we've got to make sure that we take care of the state of New York and the city of New York in their for their structural relief, and to be able to close their budget gaps.
Congressman Rose, let me give you the last word. You are both forces of nature, and there are things that you're doing that all New Yorkers are grateful for. But you talk about a war. Everyone has been enlisted. We've been asked to do our part to shelter in place, and a lot of people feel isolated and afraid. What do you say to them?
Well, what I say to them is that we're the greatest country in the history of the world. New York City, greatest city in the history of the world. We will get through this. We will rise to the challenge. What I was really heartened by to see today is that this was not a Democrat or Republican stimulus bill that we put forth. And just as this virus doesn't see Democrats or Republicans, it doesn't see race, creed, religion, socioeconomic status, we are uniting as Americans to take this on. But we have so much work left to be done, but we have the best and the brightest people tackling it each and every day. These nurses, these first responders, these doctors, the heroes that they are doing unbelievable things. And we have got to have their backs, because if we don't support them, I don't care how many ventilators you have. I don't care how many hospital beds you have. I don't care how much PPE you have. We will not be able to save people's lives. We have got to be there for them, and we will.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.